Feline Parvovirus, commonly known as FPV, is a severe viral infection that every cat owner should be aware of. Characterized by its sudden onset, the symptoms include vomiting, diarrhea, and severe dehydration. If not treated promptly, it can lead to high mortality rates. FPV specifically targets and destroys rapidly dividing cells. This has a profound effect on the cat's gastrointestinal system. The crypt cells of the jejunum and ileum are destroyed, leading to blunted villi, malabsorption of nutrients, acute vomiting, diarrhea, dehydration, and secondary bacteremia. Other systems affected include the hemic, lymphatic, and immune systems. Cats with FPV often show severe panleukopenia and atrophy of the thymus. In neonates, the rapidly dividing granular cells of the cerebellum and retinal cells of the eye are destroyed, leading to cerebellar hypoplasia, resulting in ataxia and retinal dysplasia. Reproductive complications are also a concern. In utero, infections and non-immune queens can lead to fetal death or severe neurologic abnormalities. FPV is a significant concern in unvaccinated populations, being one of the most severe and critical feline infectious diseases. The virus is extremely contagious and has a remarkable ability to survive, remaining stable and infectious for years on contaminated premises. All species within the Felidae family, both domestic and exotic, are susceptible. While kittens between 2–6 months are most at risk, adults can also be affected, often showing milder or even subclinical symptoms. The virus itself is a small, single-stranded DNA virus with a single antigenic serotype. It's closely related to the canine parvovirus and mink enteritis virus. Its resilience is noteworthy, being extremely stable against environmental factors and resistant to most disinfectants. Diagnosis is crucial. A history of recent exposure, especially in kittens 2–4 months old from premises with a history of feline panleukopenia, is a significant indicator. Physical examination findings include mental dullness, dehydration, vomiting, diarrhea, and a specific panleukopenia posture. Various lab tests, including PCR testing, viral isolation, and electron microscopy of feces, can confirm the diagnosis. Treatment is centered around rehydration, antibiotic therapy, and supportive care. In severe cases, hospitalization, for fluids, antiemetic therapy, and blood transfusions might be necessary. Prevention remains the best approach. Regular disinfection, especially with a dilute bleach solution, is essential. Vaccination is the most effective preventive measure. Regular vaccination schedules for kittens and booster shots for adults can provide almost total control of the disease. FPV is a severe disease, but with awareness, timely intervention, and preventive measures, it can be managed. As a responsible cat owner, staying informed and taking proactive steps can ensure the health and well-being of your feline companion.